What am I showing up? What am I coming up to find?
23-year-old male was hit by a moving vehicle and on a pedestrian.
Okay. Scene safety BSI call for ALS. I'm going to approach the patient. Hello, sir. From the ambulance company, can you tell me what's going on? What do I get for a response?
No response.
No response to verbal?
Sorry, yeah, no response to verbal snippet.
Okay, I'm going to have a partner hold C-spine precautions. I'm also going to check for painful response. I'm going to do a painful sternal rub and a pinch on the ear. Do I get a response?
Yes, you get a slight response. I'm not sure what would that be.
So it's slight moaning?
Moaning and then like a head tilt, like
Okay.
pulling away from your
All right.
ear.
So I've determined that my patient is responsive to painful stimuli only.
Only.
Okay, I'm going to assess the airway. I'm going to have my partner who's holding C-spine do a modified jaw thrust. As he's doing the modified jaw thrust, I'm going to look into the airway. I'm going to see if I notice anything like vomitus, sputum, any broken teeth, anything like that. Matt, what do I find when I look into the airway?
Open airway.
So I don't find anything in
Yeah,
there?
you don't, yeah.
Which we have determined it's open, I just find nothing in the
Yeah,
airway.
you don't find anything.
Okay, I'm going to measure and insert an OPA to see if my patient takes it. Does he take the OPA?
No.
No. Okay, I'm going to remove the OPA. I'm going to have it keep it by just in case. So to determine he has an open and patent airway. The fact that there was nothing found and a gag reflex ensued when I went to insert an OPA, he doesn't accept it. I'm going to now move on to breathing. I'm going to trauma expose my patient. I'm going to look at the chest for any injuries that can interfere with breathing. What do I find?
What kind of accident was it again?
25-year-old male got hit by, or 23-year-old male got hit by a car on a pedestrian sidewalk crosswalk.
Got hit by a car accident. No visible chest injuries.
No visible chest injuries. Okay. I'm going to look for equal rise and fall of the chest. Is there equal rise and fall of the
There's
chest?
equal rise and fall of the chest.
Okay, I'm going to listen to lung sounds. I'm going to listen mid-clavicular at the apices and the apices of the lungs. What do I have for lung sounds?
We have clear lung sounds, and they're even in they're consistent in respiration.
Okay. So equal rise and fall of the chest with clear bilateral lung sounds.
Yeah, equal rise and fall, clear bilateral lung sounds.
Noted. What do I get for a respiratory rate?
We're getting 16.
Okay. I'm going to place my patient on high flow oxygen, 15 liters per minute through a non-rebreather. I'm going to move on to assessing for circulation. I'm going to check for a pulse because my patient is responsive to painful stimuli only. I'm going to check for a radial and a carotid at the same time. Leanne, what do I get for a pulse? All I'm looking for is a number and a quality.
Number, we'll say 100, and then the irregular pulse on.
So I have an irregular pulse at 100.
Yep.
Strong or weak?
Weak. The radial, the wrist is weak.
Okay. With the back of my ungloved hand, I'm going to check skin color, temperature, condition. On the forehead, Leanne, what do I find for skin color, temperature, condition?
Cool. Warm. Yeah. Wow. Cool.
Cool and warm, so he's foggy.
Yep. Yeah. Clammy. Yeah, some more clammy.
Color?
And what?
Color. What color?
Pale.
Pale, cool, and clammy. Was that so hard to get a
Yeah, it really was in my back of my head. Yeah.
I'm not going to check for any obvious signs of bleeding. Coming underneath the neck, I'm looking for any obvious signs of bleeding. See what I'm doing here? I'm just coming in and out. Faith, what do I find at the neck? Okay. Shall I continue to do the whole sweep and then you tell me, or do you want me to ask for every? Okay. Under the shoulders, I'm looking for any obvious signs of bleeding. What do I find? Under the torso, down by the thoracic area, what do I find? Under the hips, I'm looking for any obvious signs of bleeding. What do I find? Under the right leg, under the thigh, any obvious signs of bleeding? Under the knee, I'm coming under the calf, looking for any obvious signs of bleeding? Some bleeding there? Okay, I'm gonna have a partner put a pressure bandage on that, does it stop the bleeding? Okay, coming down under the foot. Coming around to the left leg. Underneath the thigh. Looking for any obvious signs of hemorrhaging underneath the knee. Coming under the calf for any obvious signs of hemorrhaging. Under the ankle. Coming up to the left arm. Checking up under the upper part of the arm. Any obvious signs of bleeding? Under the elbow. I'm checking under the forearm. And checking at the hand for any obvious signs of bleeding. Coming around to the right arm. Checking under the upper part of the arm. Under the elbow. Some bleeding there. I'm going to have a partner put a tourniquet on that. Does that stop the, not tourniquet, I'm sorry. Going to put a dressing, pressure dressing on that. Does that stop the bleeding? Doesn't stop the bleeding. I'm going to have another partner put a tourniquet 2 inches above where the bleeding is. Did that stop the bleeding? Okay. Checking under the forearm and checking under the hand. Okay. I determined that this is a high priority patient. He's responsive to painful stimuli only. He has a significant bleed in the arm, which is now being controlled with the tourniquet, and some bleeding at the calf, all on the left side. And I'm going to start my DCAP PTLS, my rapid trauma assessment, starting at the head, checking for DCAP PTLS, deformities, contusions, abrasions, puncture wounds, burns, tenderness, lacerations, and swelling. Checking over the orbits, checking the mandible and the maxilla. Ray, do I find anything to the head?
You have a contusion to, when I'm talking about the patient, you're talking about injuries, do you refer to their left side or your left side?
It's always their left side.
Okay.
Which when I do that, I don't know if anybody's ever noticed, I have to turn myself so that I'm in the same anatomical direction as the patient is to know what side I'm on. It was the same thing when I worked in automotive parts. You know, I had to explain to somebody, is it the left side or the right side? They say the right side. Okay, is it the driver's side or is it the passenger side? Because it's different when if you're looking at the car or inside the car.
But it's always off the patient's left?
Yeah.
Okay.
Which I'm horrible when you give me directions to if I'm driving any place. If you tell me to turn right, I'm automatically turning left because I've gotten used to.
Contusion on the left side of his forehead and temporal area. Just gonna have a couple things. You have you have an abrasion to the back of the head, road rash, and then broken jaw, broken mandible on the left side.
Okay, I'm gonna have a partner put an ice pack at the contusion and on the broken jaw for the swelling in both areas. The road rash I'm just gonna let be for now. I'm now at the neck. I'm checking for DCAP PTLS, looking for spinal step-offs, and I'm also looking for tracheal deviation and jugular vein distension. Matt, what do I find? Okay, it doesn't have to be. Nothing found. All right, I'm going to have a partner size in place, put a collar in place. I'm now checking for DCAP PTLS over the clavicles. Brandon, what do I find?
Nothing.
I'm now checking at the chest for DCAP PTLS. Now keep in mind, this is a male patient, so it's appropriate to be kind of all grabby like that. If this was a female patient, I'd use the back of my hand in between the breast tissue and underneath the breast tissue. But because it's a male, check a DCAP PTLS over the chest. What do I find?
Nothing.
All right, I'm now coming down to the abdomen. I'm checking, starting at the upper left quadrant, going down and around, lower left quadrant, lower right quadrant, upper right quadrant. I'm looking for distension, I'm looking for guarding, I'm looking for tenderness and rigidity. Leanne, what do I think? I'm now at the pelvis. I'm going to press down and in on pelvic wing compression. Faith, what do I get for a response? No response, okay. While I'm here, I'm gonna look for signs of a prior present. Nothing present, okay. Starting over with the,
One real quick. What would be a response at the hip area?
what would be the,
You
if they
said,
what?
do I get a response? Like, what would you be looking for there?
When they press down?
Yes.
When I press down, moaning
Okay.
or feeling crepitus.
Gotcha.
Something that would be in it, unstable pelvis.
Internal pelvic damage.
Well, I can't see anything internal.
But that's why you're
I
looking
would
for a
feel-
response.
It would feel something. I wouldn't be an even response. I'd feel crepitus. There'd be one on side.
Or you would
playing
get a
out.
response verbally or audibly if the patient could. Okay.
I mean, that's gonna be a considerable amount of pain. If they responded with a groan and a head tilt to just
Yeah.
me doing this, then they're gonna respond more to that.
Okay.
So at the thigh, I'm looking for decap ETLS coming down the thigh all the way to the knee. Now, what do I find at the left thigh? At the right thigh? Looking for decap ETLS.
Nothing.
Okay. Checking the knee. I'm checking the knee to make sure that for decap ETLS and to see if it's midline. What do I find?
Nothing.
Okay. At the calf, checking decap ETLS coming down the calf, coming down the shin. What do I find?
Fracture. Fracture. No.
Okay. So I can't diagnose this as a fracture. What we could say is an angulated deformity.
Okay.
Is that what I find?
Yes.
Okay. Noted. I'll have a partner put this in a splint. Not a traction splint. I'm going to have him put it in a regular splint. At the foot, I'm looking for decap ETLS. Checking to make sure that all 5 toes are there and checking for a pulse. What do I find?
Strong pulse, and nothing. No decap details.
Okay. Moving over to the left leg. Checking decap ETLS coming over the thigh, coming down the thigh. Matt, what do I find? Checking the knee for decap ETLS, making sure that it's midline. What do I find? Coming down the shin, coming over the shin and the calf, looking for decap ETLS. What do I find? And at the foot, checking the decap ETLS, checking all, make sure all 5 toes are there, and checking for a pulse. Okay. Coming up to the left arm, checking decap ETLS at the shoulder. Brenda, what do I find?
Nothing.
Checking over the humerus, looking over the humerus in the flesh, checking for decap ETLS. What do I find?
Nothing.
Checking at the elbow for decap ETLS. What do I find?
Nothing.
Checking down the forearm all the way to the wrist for decap ETLS.
No.
Checking the wrist for a pulse. Checking the hand for decap ETLS and making sure that all 5 fingers are there.
We have a pulse and everything is fine there as well.
Okay. You might not have been here, but we applied a tourniquet to the sun.
Yeah, it was.
Okay. Checking decap ETLS at the shoulder on the right side. What do I find? Checking decap ETLS coming down the upper part of the arm over the humerus. What do I find?
Nothing.
At the elbow, looking for decap ETLS. Anything?
No, just the bleeding that you already took care of.
Checking the forearm for decap ETLS.
Just a couple of bruises, nothing too serious.
Okay, then I have a partner put ice packs over the bruises. At the wrist, checking for decap ETLS. Checking to make sure all 5 fingers are there and checking for a pulse.
Pulse is weak because of the injury to the elbow, but other than that, good. So it's a little weak.
There should be no pulse there because we have tourniquet.
Oh yeah, no pulse, yeah, they're good, yeah. They're yellow.
Now keep in mind, the examiners already have this information to answer these questions. They've got like a page long of all this is, where they're not paying attention to what somebody else has said before them. So I know this could be a little bit, trying to remember everything, but anyway, it is what it is. Okay, now I'm gonna check the posterior of the patient because the injuries are all on the right side. I'm gonna log roll him onto his left. I'm gonna have another partner assist. I'm gonna have my hands at the shoulder. in the hips. I'm gonna have a partner have his hands at the hips and the ankle. My partner is holding C-spine count of 3. We're gonna log roll the patient towards me. If you're using a dummy, you have to log roll them. If you're having a live patient, the examiner's just gonna tell them to turn on their side. So count of 3, log roll. I'm checking decap PTLS on the thoracic, coming down the back, over the lumbar to the belt line. Faith, what do I find? Okay, my partner's count of 3, who's holding C-spine, we're gonna log roll him onto a backboard. Okay. I am now going to get a set of vital signs, a full set of vitals. I'm looking for a heart rate, a respiratory rate, and a blood pressure. I'm also looking for pupil dilation because my patient is responsive to painful stimuli only. What do I get for vital signs?
Pupils are unequal but reactive to light. Pulse is still at 100. Blood pressure is going to be 105 over 60. And pulse pressure. There's one other pulse pressure.
Respiratory rate.
Respiratory rate is going to be 14.
Okay. Your blood pressure should always be even numbers. So instead of 105, go 104 or 106.
106. 106 over 60.
Yep. All right. Is my patient still responsive to painful stimuli only?
At the moment, yes.
Okay. Is there anybody I can ask the sample history of? Any friends or family?
Say yes for this. Yes. Yes, he has a mom on scene.
Okay. So to the mother, I'm going to ask. Actually, I'm not going to ask signs and symptoms. I know what they are. He's unresponsive. He's responsive to painful stimuli only. Has a significant bleed on the right. Shallow and thready pulse to the right. Strong carotid pulse. Various cuts and contusions and a broken jaw. Allergies. Is he allergic to anything? Matt?
No.
Okay.
No known allergies.
No known allergies. All right. M, medications. Brandon, does he take any medications?
No, I'm not taking medications.
Okay.
Young, healthy.
P, that's probably medical history. Does he have any medical history?
No.
L, last oral intake. Hey, when was the last time he had something to eat?
4 hours ago.
Okay. And events leading up to what happened, what was going on before he got hit by the car?
He said he was leaving the house to go for a run, so he must have got hit while he was working out.
Okay. Now that I have all that, I'm going to do my detailed physical assessment, which is going over everything I've already done, paying closer attention to the head, looking for battle scars, which is the bruising in the back of the ears, raccoon eyes, which is the bruising around both eyes. I'm also going to look for any cerebral spinal fluid coming from the nose or the ears. Matt, what do I find when I do my detailed physical exam to the head?
Does that include, like, because didn't we say he had the back of the neck?
There was some abrasion, road rash to the back of the head.
So you just still have that?
Okay.
Nothing else?
I've treated all my secondary injuries as I found them. The reason why I didn't treat the back of the head because we're still holding C-spine. I could have when I log rolled them, and I was checking the posterior. I had a partner put a bandage to that abrasion on the back of the head then. My ongoing assessment en route to the hospital, I'm going to go over everything I've already done, including my interventions, and get vital signs every 5 minutes. Questions? Did I skip anything?
No skipping, but I have a couple of questions.
Okay, shoot.
So for the neck injuries, it was spinal step off, jugular vein distension. What was the third one?
Tracheal deviation.
And they want to hear you say that, right?
Yes.